Always a pleasure. Well, thank you very much, gentlemen, for making time. Now, I want us to look at what is making headlines in the local dailies, but even before we look at exactly that, starting with you, Mr. Owino, one of the things that has been affecting Kenyans for a while is the issue of the transition from NHIF to SHIF. And we did run a story a few moments ago regarding how patients are suffering, especially patients who have chronic illnesses. And patients now have to pay, for example, those who are undergoing dialysis have to pay around 9,500 in regards to, for them to get the dialysis sessions. So, what is not happening?
Number one, I think this is a transition. And many a time when such transitions take place, we'll always have hiccups. It's a very good idea to have the social health because it's more broad-based. You know, one of the pillars for the current government was health, transformation of health. And if you look at the government agenda, it's an agenda for building the bottom, the common mwananchi. And a lot has been done so far during the transition. One of the major problems that we are facing is that, you know, about 46% of the hospitals we have at the lower level are faith-based hospitals. I think you saw a bishop talking over it. And there are debts which were accrued for NHIF, which have not yet been paid. Yes. But I think this week and next week, the government is going to roll out about 1.5 billion to pay those debts which were pending, because that was the biggest worry that they had. But equally, the other challenge is registration, because each and every person has to register with NHIF. And during the registration, the civil servants were transited from NHIF to SHIF automatically, but people are not transited with their families. So what it requires is that you transit with your dependents, and a number of people are being encouraged to transit with their dependents. Equally, the other challenge was this is a universal health coverage. I know the civil servants had a bit of issues because initially the maximum was about 1,700 for everyone, and even those who are earning very high, but now they are paying 2.75%. So those who are earning as much as 1 million will be paying about 33,000, 27,000 per month. There's a group that will pay about 13,700 per month. There's a group coming down up to 300 shillings. But equally, a number of people, because of means testing, I'm sure people will pay as low as 100 or even 200 for those who will be quite poor. So we just want to encourage Kenyans to enroll as much as possible, because it is pulling up resources. That is the objective, enroll as much as possible. And you know, now level 2 and level 3 hospitals were not included in NHIF. And then the primary health care is supposed to be free, testing of malaria, testing of heart problems, and so on and so forth. So it's a good program. I know transition is very difficult, but so far so good. Quite a number of people are registering. We are encouraging people at the local level, county governments, ward administrators, and even the chiefs to support in this process, and more so a number of women are supporting government in this registration. So I think it is important that every Kenyan picks on this. Okay. There will be teething problems here and there, but so far government has done fairly well. Wananchi are supporting the process, and a number of things are in place for this to take place. I know there are cries here and there, but so far so good.
Okay, thank you very much. Coming to Mr. Theory, there's a story on the front page of the People Daily. And I don't want us to talk about the issues of Mount Kenya yet, but there's a story on the topmost part of the People Daily, and it says Ruto summons top sports officials over Afon Billions. Now, this is a story that has been making headlines since last week, but one, in regards to the officials in the Ministry of Sports spending at least 1 billion in consultancy fees ahead of AFCON, and this is against the directive of the president, and not only the directive of the president, because they say. Before he left the sports ministry following the dissolution of the cabinet, the sports CS Ababu Namwamba, in a letter dated 26th of June 2024, directed all departmental heads in the ministry and semi-autonomous government agencies under his docket to immediately terminate the services of consultants for AFCON. Now, we were talking about this last week with Mr. Sosion. One interesting fact about this particular issue is that not only did they disregard the directive of the president and the former CS, that is Ababu Namwamba, but also questions are being asked regarding the composition of this particular sports fund board, because they all come from one ethnic composition.
I may not be privy to what has been going on with on this AFCON thing and getting us ready, but I think it is in public domain that we are way behind in terms of our preparations to host AFCON, and again, that is something that puts our reputation as a country at stake, and you expect that for such a significant honor to the country, that all hands would be on deck, and that when issues such as disregard of directives, either from the CS or from the president, then come up, that in itself is not only an act of insubordination, but in a sense it is embarrassing the entire country. And so we hope that we will see certain decisive steps being taken to ensure that we are not spending money on non-core AFCON preparation activities, because you have all these consultants, yet the stadiums are not ready, the venues and all that are not ready, and that is what we should be focusing on. So if we are speaking about 1 billion that has just gone to give advisory services, you get the feeling that we are spending money on things that are not important. And I think that is the challenge that generally this administration is having. If you look at the comments that my fellow panelist has just spoken about with regards to SHIF, you see transitional challenges that tell you that the government was not well prepared to deal with those issues, because the debt of NHIF was known, the structure of SHIF and how it is different from NHIF was known, the benefits are known, the health providers are known, the beneficiaries of NHIF are known. So you would expect that the government would have planned the transition in a way that gives less pain to those that are coming in. But for everyone involved, and this has been the thing that we've been looking at, and we've also been looking at it even in our office at a personal level, the amount of money that we would be required to pay vis-a-vis the benefits are not coming out very clearly. Of course, we understand that in this transition, some of those things may not be very clear, but generally, I think we are seeing a manifestation of a problem in the way certain officers in government are handling issues that are extremely important to the country. And I think that they need to be called to order, because otherwise you will be in a state of continuous complaints about how government is managing the funds that are available to them and the things that are extremely important, because if you look at AFCON, it's not just about the sporting aspect, it's also about the economic benefit that comes around hosting yes. Such an important activity.
Correct. Mr. Susion, let me just ask you in regards to the issue of transition from NHIF to SHIF. Now, the ministry is on the spot. Questions are being asked. Why the rush? And appearing before the National Assembly Health Committee, CS Deborah Mulongo was at pains to explain the entire social health insurance fund. And one of the key issues is that the ministry says it undertook a pilot program across 8 counties in the country. But that is not even in contestation, because out of the 8 counties, they only did a pilot program on 2,000 Kenyans. 8 counties, 2,000 Kenyans. For them to, is that number sufficient enough to even determine and assess the real situation, on the ground?
Migrating the country to universal health coverage is not an idea of yesterday. This was conceived early in the year around 2000, and a pilot study was conducted across the world by the board membership of NHIF. They visited Argentina, Germany, and some Asian countries where universal health coverage has worked out very successfully. And NHIF conducted a pilot program, actually, a very extensive pilot program. And,
what do you mean extensive?
Yes, a very extensive and detailed pilot program was conducted around 2009 and 2010. Mm-hmm. And the rollout has always been contemplated and not implemented. Mm-hmm. But now with the Kenya Kwanza administration, it's a key pillar number 5, that we must roll out the UHC, and it's being rolled out with effect from 1st of October. There was a transitional period for 1 year, and that period should have offered an opportunity to do simulation of the system, development of ICT, infrastructure, and transiting fully from NHIF to SHA. No one has explained exactly what the people who were involved have actually been doing for the last 10 years, the last 1 year rather, that then from 1st of October, it is like you're struggling to do everything that should have been done way back. Those are facts about inefficiencies in implementing the program. And when you see the CS is at pains to explain, it means the whole migration is mammoth, and it cannot be done all of a sudden. It's not a switch-on, switch-off affair. It's a process of developing systems. And when you look at, we're being told 104 billion will be required to develop a new ICT infrastructure system. You're trying to do new things and bypassing the existing system that existed in NHIF. I think what should have been done is to begin from known to unknown. Start from NHIF, what worked at NHIF, migrate it to SHA, and use it to work. But trying to bring in new models that have not been simulated, that have not been tested, and that cannot even link with the patients. You know, the patients report to the facilities, but they're not matching with the data in the SHA system. That really is a tragedy. It's a fact that we must admit. The truth is, we must admit the mistakes that exist, identify those gaps, and try to seal them. And you can see the facilities have been told, can you proceed and treat patients, don't return any patient. And you get the facilities that are finding it very hard to execute that, particularly matching the data that is contained in the SHA with the patient. So we agree there's a real challenge here. Mm-hmm. Let's not call it teething. Let's call it serious issues that requires thorough address and quick ones, so that you migrate everybody. We don't need to have the civil servants running their own scheme if we have a working UHC. We don't need to have the teachers running their own scheme if we have a UHC that works for everyone. We need something that works from everyone. And of course, if you look at the 4 bills that were developed, the 4 acts actually. The 4 acts are supposed to aid it to work, from Improvement Facilities Act, so that then we ask, are the facilities ready? Do we have the personnel? Do you have the medicine? Do you have everything ready in place?
Fair enough, Mr. Sossion.
Yeah.
Mr. Wino, coming back to you, because you addressed this particular issue. Yesterday there was talk around, Adani's entry into this particular health scheme, and that saw a 56 billion rise in the cost of the health system in the country. I mean, 56 billion. The initial cost was to be around 48 billion, but now the cost stands at 104 billion. All this money, but still, patients are bearing the brunt, because Mr. Sossion is talking about, it being mammoth. And question is, at what cost? Because we are rushing this, but at the cost of, the lives of millions of patients out there, because people are crying. For example, there's someone who says, out of nowhere, because NHF is not working anymore, they have to now pay 22,000 per session to access certain, sessions, and that's very, very costly. And for a normal Kenyan out there, they cannot afford that. Kenyans cannot even afford to put food on the table. How can they get 22,000? So, how can the government fix this? Because health is a very, very key pillar, and it's very, very important for a country's growth.
Number one, I heard you mention Adani and health.
Yes.
How are they related? I'm not sure whether there is a relationship between Adani and health. I know there's something about Adani and energy.
Yes.
I know there's something about Adani and airports, but I don't know about Adani and health.
Okay.
Yeah.
It's a story that was on the headlines of yesterday's newspaper.
First of all, the reason why certain institutions were demanding money is because of the debts which had apparently not been paid from NHIF, the debts that were pending. We've just seen the faith-based organizations crying that they would want to be paid the money. And that's what I said, government has rolled out money this week and next week, about 1.5 billion, to pay these health facilities. But the agreement is, and the discussion is, that no patient should be sent back home for some of these treatments. And a lot has been put in place to ensure that these patients are not sent home. And that is why this money has been rolled out to support the institutions, because they can also not run without money. What I want to say is that this is the universal health coverage. It's a very important area for us as a nation. And you've just heard Mr. Sossion talk about improvement of health facilities. It is a factor in this program that certain amount of money will go towards improving the facilities, to an extent that if this money comes out, the governor cannot use it to go and pay workers or to go and develop roads. It will purely be used to develop the hospitals. So what I'm saying at this particular moment, as a nation, we are fond of complaining. I'm saying it's not bad to complain, but I'm saying that we need to know. It is. What I'm saying is that all of us as a nation, we need to come together at a time of crisis.
Now, let me
just a minute. Just give me a minute. He has said that there are problems that we are facing with this transition. We need to admit that there are problems that we are faced with this transition. But as a country, we need to support the program and the process to ensure that it is successful. Number one, we don't have any other opportunity. This is the only program that we have in health. We have already transited from NHIF to SHA. So what we are saying is we need to support it. Even yourself, when I live here, I want to ensure that you are registered in SHA. I hope you are registered. You
see, when you talk about supporting the program,
yes,
you can tell me that I can support. You can say I support. I can support the program.
Yes.
What about the patient who's in the hospital right now?
I've just explained that as we speak today, government and health officials have made arrangements to ensure that nobody is sent away from hospital. And I've just told you that one of the reasons why we had hiccup was because a lot of money was owed to some of these hospitals. And arrangements have been made this week and next week. They're rolling out 1.5 billion to ensure that these health facilities are paid.
Question is,
so I would only be wrong.
Question is, Mr. Wino,
yes,
where was the government all this time before rolling out this particular transition from NHIF to SHIF, so that we are now sorting issues after they've
what you need to understand is that governments always transit. You don't say these problems were there in the previous government. When you take up government, you must run government from where you find it. Some of these were pending bills for very many years. And you must understand that government has to facilitate each and every person. So a time reaches when you have pending bills that you need to transit with, and you have not paid them, and a program has also come that must be transited. He has just told you this program started in 2000, not now. And every time it came up, there was fear of rolling it because of some of these problems that we are facing.
24 years later, we had to get it right.
Yes, so at this particular time, the government decided to take the bull by its horn and say, fine, let's move on, because we have to transit. So what I'm saying is what you are seeing today, in 1 week, in 2 weeks, in a few days coming, you will not see much of these problems. And that is why we have said government has ensured that there is money to pay the health facilities. And it is 1.5 billion. And once this money has been rolled out, we don't expect these hospitals to have problems. But what we want you to encourage most Kenyans in the media houses is please let them enroll as many as possible so that we can be able to support this program. Remember, I've just told you, health centers and dispensaries are on this strongly, and that is why you find that the primary health care, some of the basic things are supposed to be even carried out for free. Okay. And therefore, it requires support of all of us so that we can be able to pull up funds so that we can support this program. Okay,
fair enough. Just because of time, I want us to move a little bit away from that particular issue to the issue of cash crunch in counties, Mr. Theory. Counties are now staring at a cash crisis because the Senate and the National Assembly are yet to agree on the equitable shareable revenue, because the National Assembly slashed the figure that had been agreed in May from 400 billion to 380 billion. And the Senate disagreed with that. They sided with the governors saying, no, we are not taking 380. We agreed on 400. In fact, we wanted 439, but you brought the figure down to 400. But the National Assembly Budget and Appropriations Committee says, no, we are not giving you 400. We are giving you 380 billion. Take it or leave it. But that is, throwing the counties into sort of jeopardy.
The counties have had challenges in getting funding for quite some time. And I think it's a general problem that is in the country. Nearly every other institution has suffered budget cuts. And so when you look at this amount, it's actually largely arising from the reorganization of finances that had to be done with the collapse of the finance bill 2023. So that again becomes something that has to be taken into consideration. Now, if you listen to the governors, they probably would be saying, and I know this has been the position, that even the cash that they expected to get last year, in the last financial year, has been a challenge. Some of it has not come through as of now. So I think in the overall, we have a problem in government in terms of raising resources. Although Mr. Owino here is not willing to accept that there is a problem, when we now say in October that actually we are now making available 1.5 billion to pay some of these health facilities, and 1.5 billion looks like a lot of money until you put it into context that it is for the entire country, and that the number of hospitals that are then entitled to that money, it reduces that into a very, very insignificant amount. But that is not the point. The issue here is that generally there is a problem in terms of managing the country financially. The schools have been having a problem. If you look at the position that is being taken on SHA, The universities have also been told the same thing. Do not take the students, do not send away any of the students as we sort out this question of how you will get your money and the funding model for universities. So generally speaking, and I think this is what I just wanted to say, is that there are very good initiatives that the government is taking on board. Universal healthcare is one of those initiatives. The challenge that we are experiencing is the challenges of implementation and lack of clarity in terms of implementation. I know there's a question which you asked about the entry of a certain provider into the original healthcare system that then inflated the cost. I do not want to speak about it so much because I know that it is an active case that is ongoing in court, and so we may want to respect that and allow the court to make a determination of that question. But that does not mean that we cannot say that the fact that there are those challenges, and it does not always mean that anyone who has gone to court is right, because the court will make its determination. But there are many challenges, and one of the challenges also is this ongoing court cases, because they make it very difficult for issues to be resolved. But the bottom line should be that there appears to be a crisis when it comes to implementation of very critical government services, because something like health, something like education, those are so critical to a vast majority of Kenyans that whenever there is a crisis in those areas, the pain is felt in many pockets across the country. And that should be what we should now be saying. It's not that Kenyans are complaining, because Kenyans are paying taxes, and so they expect to get services from the government. And they, when you call upon government to provide those services, that should not be seen as an act of complaining. But what we should be looking at is actually positive criticism of the processes and the initiatives that the government are taking, because that criticism is intended to assist the fair efficiency of those processes.
Fair enough. Gentlemen, because of time, I just want us to wrap up the newspaper review, because the health issue is a very, very critical issue, like Mr. Theory says, and it needs much emphasis. Now, on that note, we just take a brief breather. We'll be back with the state of politics here in the country. Don't go away.
When it's a Saturday, there's only one entertainment show in East and Central Africa. Arena 254. Join Aisha Wanjiku and Tony Mwirigi for all the artistic interviews fused with amazing entertainment conversations and sizzling hot live DJ mixes.